Vision therapy. What is it and who would benefit most? Find out in this week's episode of the IQ podcast with me, Dr. Rani Banik, where I'll be interviewing a special guest who is a neuro-optometrist specializing in vision therapy. So tune in. Welcome, everyone. Welcome to another episode of the IQ podcast, where you can gain insights to raise your IQ on eye health and vision health and brain health. I'm your host, Dr. Rani Banik, and today we have a super interesting topic, something that I've been wanting to cover for a very long time, and that is the topic of vision therapy. And I am so excited to welcome my special expert guest to the podcast, Dr. Bryce Appelbaum. So Dr. Appelbaum is a neuro-optometrist, and he is passionate about unlocking life's potential through vision. His expertise includes reorganizing the visual brain post-concussion to return to learn and return to life, remediating visual developmental delays, interfering with reading and learning, and enhancing visual skills to elevate sports performance. You may have seen Dr. Bryce on the podcast circuit as a recent guest on Mind Body Green, Chris Kresser's Revolution Health Radio, and Cynthia Thurlow's Everyday Wellness. Thank you so much, Dr. Appelbaum, for joining us today on the IQ podcast.
It is such a pleasure to be here. Nice to see you and excited for this.
Nice to see you as well. So Dr. Appelbaum and I met. We are part of the same healthcare community. It's a community of health and wellness entrepreneurs. And we met a few years ago when we've been talking about, kind of sharing ideas. And I'm so excited to now give him this opportunity to share his ideas with everyone else. So I always like to ask this question to start out, Dr. Appelbaum. So how did you first get interested in what you do? How did you get interested in optometry? Please tell us that story.
So I have a pretty interesting story. I'm a product of the work that we do. So for me, it all kind of started in first grade on the soccer field at Cardock Springs Elementary School. And I remember this beautiful fall day, leaves were coming down. My team was playing the Purple People Eaters. And there was this moment that I can literally remember as if it happened yesterday, where I'm the lone defender. There's these three attackers on a breakaway coming at me. It's just them, me, the goal behind me. And I completely freeze as if my legs are just stuck in quicksand. And they blow past me, easily score. And I remember just feeling so lost in space, afraid, helpless, that I let my teammates down, essentially giving away the goal to the other team. And at the time, I had these visual developmental delays. So what that meant was I had trouble focusing my eyes. I had poor depth perception, and my eyes didn't really work well together as a team yet, causing me to freeze in moments where I really should have sprung into action.
Mm-hmm.
And so that night at the dinner table with my parents, I had a complete breakdown. The tears came out. I shared how I didn't know where to be on the field, what to do, and how in the classroom I was so lost, having difficulty seeing the board and having to ask my friends what the teacher was writing. And then I would just be flying through these other subjects like math to kind of compensate for my deficiencies with reading. And I really had, because of my vision, this negative confidence that made me feel like a turtle retreating in my shell in so many aspects of life.
Mm-hmm.
And so fortunately, I was born to the perfect parents. My mother was an occupational therapist, my father, a developmental optometrist. And it wasn't really until this breakdown that they put all the pieces together to understand the gravity of the situation. And that's when they really put the plan of action into place for me to really facilitate the necessary vision development to help me soar in life. So I did, for the next several years, consistent vision therapy, office-based, consistent sensory integration-based occupational therapy every week. And because of this consistent nature, it all kind of came together for me a few years later in like the fourth grade, with my eyes, my brain, my body all finally started working together. This confidence emerged. I became a stud athlete. I started enjoying reading. I developed interpersonal communication skills that really allowed me to turn this disability into a strength where I could rely on vision to gain an advantage in the world. So for me, I feel like I'm here so that others don't have to struggle the way I did. And what was accomplished for me in years, we can now do in months. So I am very grateful for the work that was done for me, and then what we're able to do for others now as we've learned more, so we can learn so that we can all do better.
Yeah, well, thank you for sharing that. I'm sure it's a very personal story, and I'm sure it has had its ups and downs. And one question: so, your father is a developmental optometrist. Was your vision corrected at this time? I mean, did you wear glasses? Were you 20/20, and you still had some of these issues, these integration issues, these sensory issues?
Great question. So my father was very old school, and so 35 years ago, 40 years ago, at least in his field in developmental optometry, the school of thought was undercorrect,
Mm.
bifocals for near, rigid gas permeable lenses, and I think we've all learned a lot more since then. But I had correction, but really acuity was not where it needed to be.
Mhm.
And I always like to talk about the difference between eyesight and vision because although eyesight wasn't perfect, I had a vision problem. I had a brain problem. I hadn't developed the visual skills and abilities necessary to thrive in life. And it was a delay in terms of all that I was struggling through with sensory integration dysfunction and all these other challenges early on.
Mhm. So interesting. So yeah, so people can still have excellent vision or very good vision, yet have some of these other issues. So now, so you became an optometrist, and so how did you get interested in this field of neuro-optometry? Maybe you can just explain to us, like, what is neuro-optometry? How is it different from an optometrist?
Yeah, so I get asked this question every day, and I think there's a lot of differences to me. It's really simplified into structure versus function. So, most eye doctors, most ophthalmologists, optometrists, whoever, there's specialized training in the intervention of eye disease, neurological disease for neuro-ophthalmology, and really assessment of structure. And then I think for neuro-optometry, we have specialized training and clinical experience in visual deficits or problems as a direct result of physical disabilities, traumatic brain injury, neurological insults, developmental delays, really an understanding about how specific visual dysfunction can relate to symptoms and performance. And so, I for a lot of different reasons, went all in with neurooptometry. And, I think from a head injury standpoint, there's such a need. And now from a screen time standpoint, there's
Mhm.
such a need. And I'm sure we'll get into all of that. But, that's a confusing question for many patients is what is the difference between all these words that sound similar, that have an O in them, but no one can really understand? And I like to talk about it as how the eyes are working together, how the eyes, brain, and body are integrating and processing information, and how we're deriving meaning from the world around us and then directing the appropriate action. And so
Mhm.
the neurooptometry is more kind of the therapeutic intervention, the improvement of activities of daily living, the allowing performance to be optimized based off of vision, guiding, and leading rather than potentially interfering.
Sure. So, how was the training for neurooptometry? Like, what does that entail? If anyone's interested in learning more,
Yeah.
perhaps pursuing it as a career.
So, I mean, even just pulling back to vision therapy, which vision therapy can be for a lot of different problems, conditions. Um, there's so little taught in school because there's so much on just, dipping your toe in so many different areas. And so I think to really become confident and an expert in this space, you have to pursue a residency program and a fellowship program to really challenge yourself to learn more about what you have more questions about, but to really, for the benefit of your patients, to be up to date with the latest research and literature, to take clinical practices and protocols and help evolve them. And although it's not, I would say, necessary, I do think there's a big distinction with more training and more testing and more learning that really allows us to best care for our patients.
Now, I want to touch back on something you said earlier, that there is a difference between a neuro-optometrist and a neuro-ophthalmologist. So I'm the latter, you're the former. And I think it's really important for people to understand that neuro-ophthalmologists look at things from, as you said, the medical side, the structural side, what is going on anatomically that may be causing certain findings on an exam. But what you do is different in the sense that you take those findings and you translate that into function and how people are doing in their daily lives. right? If I'm saying that correctly.
100% accurate. And I always say, I mean, there is a place for both specialties with most patients. And I work very closely with lots of neuro-ophthalmologists, ophthalmologists with collaborative approaches. But, you know, Dr. Rani, I know how exceptional you are in terms of knowledge, experience, all that. Your training is far more thorough and diverse in neurology, right? I mean, it should be. And I would say our training is, much more in function and development, but there is absolutely a place for both professions to have a healthy, happy marriage where we support each other. And that's not always the case with certain practitioners around the world who, um, are limited in terms of their ability to expand and evolve.
Yeah, I think you hit on a really important point there. It's collaboration. And they're not exclusive. They're not exclusive of each other. And I'll give you an example. Like I oftentimes see a lot of concussion patients. They get sent to me from hospital for special surgery, professional athletes, or just kids who are playing on their sports team and they develop a concussion. And I do their eye exam, and their eye exam, at least based on what we test, is normal. And in that case, they still have visual symptoms, whether it's, tracking issues, inability to read, light sensitivity. So in that type of situation, yes, sometimes I do refer them to a neuro-optometrist to help them get back their ability to see clearly and to integrate everything and to get back to their original baseline state. So it's not exclusive by far.
Absolutely not.
Yeah.
Absolutely not. And, there's more areas of our brain dedicated to processing vision than all of our other senses combined. So even if testing doesn't show exactly what a textbook should say it shows, really listening to the patient and listening to their symptoms and their challenges as potential paths or solutions to help solve those problems. I mean, that's why your patients love you so much, is because you're looking out for their best interests and not afraid to open up for assistance from others.
Yeah, absolutely. So, we've talked about why patients may have some vision issues that require vision therapy or would be helped by vision therapy. We talked about concussion. Let's talk a little bit about sports, other types of sports performance and vision therapy. Can you give us some examples of types of conditions that you help to manage in some of your patients?
Absolutely. So we're all told as children, keep your eye on the ball for sports, but we're never really taught how. And so, my private practice, the vast majority of the patients that we treat have visual problems, dysfunction, and they're struggling. But we also see a lot of people for optimization and enhancement. And I work with a bunch of pro teams, individual athletes, really anybody's visual skills and abilities can be improved. It's a matter of whether improving them does anything to really improve life. So, in terms of kind of conditions, I would say there's really five profiles that we kind of treat the most in my practice. And the first would be, um, you know, traumatic brain injury and specifically concussions, just like you, where so often the symptoms that emerge after a mild or major head injury can have devastating implications on life, whether it's the uh, difficulty reading and losing their place or engaging with screens or the light sensitivity or the sensory overload in environments with lots of busy crowded periphery like malls or grocery stores. I think vision therapy can be life changing in terms of helping that individual return to learn, return to life, and get back to how they were functioning. So that would be the first. Second, visual developmental delays. Every functional visual skill is a learned skill. We're not born with them. They come through our life experiences. They're either learned well or not learned as well as they could be. And that's when some intervention is needed. So the individual mislabeled as having trouble with attention or difficulty reading and dyslexia or ADHD or whatever the labels would be, you got to rule out vision first because those are incomplete diagnoses if there are other problems in place causing the exact same symptoms or behaviors. We see a lot of strabismus and amblyopia for number three. Strabismus being eye turn, amblyopia being lazy eye. So often somebody will have potentially knee surgery, but always do physical therapy after and often before. And with strabismus or eye turn, so often the surgery is done to correct uh, what is in place, and vision therapy is not even looked at as an option before or after. And I would also argue that many strabismus cases are not eye muscle strength or length issues, they're coordination issues and brain development issues. And so a lot can be done to help that. Amblyopia, we now have research to show that lazy eyes are very often a two-eye problem manifesting on one side. So unless it's addressed on a two-eye basis, teaching the brain how to get that eye that's not functioning as well to be locked in and engaged with the other eye, that really advanced treatment can avoid the need for patching or speed up the treatment, or even allow for the outcomes to be with an even higher ceiling. We do a lot of myopia management. We do a lot of sports vision training. And I think that last area is really the almost like biohacking or
Mhm.
optimization enhancement, where, we exercise our body and our muscles, but some people think that exercising your eyes, well, why would we never do that? Um, any brain at any age has the benefit of neuroplasticity to be rewired and altered to change how somebody's using vision. And vision does not need to deteriorate at the level that it does for so many people, yet everyone thinks that's kind of their new normal. And I will say, the people who say that eye exercises don't work, I think those are the same people who say that normal exercises don't work. Well, exercising works, but you got to do the right stuff and be in the right place and have the right guidance. So
Mhm.
amazing what can be possible when we can be proactive rather than reactive with this type of work.
Mhm. Wow, it's so interesting the breadth of everything that you see and uncover some of these issues that patients oftentimes they don't realize that this is really what's causing their problem. They may attribute it to something else, but it in fact may be vision. So I'm going to now ask you something that is a little bit controversial, and this
Love it.
is so this is something that's been a point of contention amongst our two areas, our two subspecialties, neuro-ophthalmology on one side and neuro-optometry on the other side. So a lot of my colleagues in neuro-ophthalmology, they don't believe in neuro-optometry because they say that there's not enough research to show that some of the techniques used, the treatment protocols used actually work. And so there's been, this call for, okay, there should be more published literature out there before we're recommending some of these therapies to our patients. So as a neuro-optometrist on the other side, what is your response to that? Like, why is there not more published research in neuro-optometry to really provide a more balanced kind of approach to vision issues?
Dr. Rani, thank you for bringing up an elephant that is in many rooms here. So you are right, there's not enough research. I will say there is groundbreaking research to prove the efficacy of this type of work for certain conditions, but a lot of the really good stuff is within the last decade or so. And I recently read an article that said the average piece of research doesn't get put into clinical practice until 17 years after it's been published, which means by the time that's the new standard of care, we've evolved and we're in a new place. So there is not enough research. I will say, I think the biggest problem is there's not enough consistency among doctors providing this type of work in terms of treatment approaches and training and understanding. And if you take vision therapy, for instance, there's board certification in vision therapy from COVD, the College of Optometrists and Vision Development, but you don't have to be board certified to offer vision therapy. And now even OTs and PTs and teachers and coaches are offering what they're calling vision therapy because the need is so great. I'm sure many of these people help a lot of people, but I would argue the level of care is very different when you're with somebody who that's their expertise. And just like physical therapy, vision therapy works, but you have to be in the right place and do it for the right reasons. So I think if we take amblyopia, for instance, which is the medical term for a lazy eye, we have evidence now on the efficacy of a binocular approach to amblyopia therapy. And this is definitely considered more advanced treatment that is evidence-based, based and proven to be effective for nearly all ages. And yet, with amblyopia, the old school standard of care is eye patching and atropine drops, which there is a place for those and they can help some people. But we know that even if eyesight improves in those scenarios, it often regresses when discontinued, or patching doesn't treat an underlying eye coordination problem that's in place. It actually makes it worse because you're preventing the eyes from working together and taking a fragile system and not letting it work. And not to mention the psychosocial and emotional toll that patching, let's say, can take on a child. So, it is a big problem. And I know I'm part of a group called Vision Help, which is a lot of the leaders in our space that our sole purpose is to raise awareness and advocacy and help uh, guide the research and the literature for what our profession needs. And, it takes a whole village to continue to allow this to evolve. But I do think as we're learning more about head injuries and as a medical community, more what we do know, what we need to know more about, vision therapy has proven to be a missing piece to many people's puzzles for recovery. So I think that's allowing vision therapy to get a better seat or a stronger seat at the medical table, but then also with screens as well. I mean, screen time has become the new pandemic, and most of
Mhm.
us do not have the visual skills and abilities in place to handle those demands. And yet, here we are, everyone's staring at screens. So I do think the landscape is changing a lot, but we still have a long way to go.
Mhm. Yeah, I think you really hit the nail on the head in terms of the lack of large clinical trials when you mentioned that the protocols are so varied, right? There is no standard protocol for vision therapy for concussion, for example, mild traumatic brain injury or more severe traumatic brain injury, or to enhance sports performance, because there are different providers. You're doing your own protocols, but there's not one cohesive protocol. So I think that would be something, hopefully, that can be developed in the future, and then it can be investigated. The other thing you mentioned, which is really interesting, is that there is oftentimes a lag between when something is published compared to when it becomes mainstream and used widely in clinical practice. So hopefully, again, there will be more studies. I look forward to them, actually. And then this information does get disseminated as to some of the benefits of the therapies that you recommend, especially for amblyopia, for example. I can also say that as an integrative provider, there are many things that I recommend for my patients that don't have large clinical trials behind them. And simply because there is no large clinical trial behind it does not mean that it cannot work. And so, some of our patients who come in really struggling with their vision, they're desperate. They've maybe tried everything else. They've tried the glasses, they've tried the bifocals, they've tried this, they've tried that. It's not working. And in that case, is it really harmful to have them do a trial of vision therapy? I mean, what's really, if you take the risk benefit ratio, why not? And so again, there are some things, and I do have an open mind to this, that as an integrative provider, I am very open to patients exploring, because what works for one person may work for another person or may not. And so they will only know unless they try it, only know if they try it. And so, yes, there may not be large clinical trials, but some people really can benefit, and it's worth a try. Welcome back to the IQ podcast. Today we're talking with Dr. Bryce Appelbaum, a neuro-optometrist specializing in vision therapy. So far we've covered a couple of different topics. Now, I'd love to talk more about something you mentioned a little earlier, which is our vision and screen time. And I know you had said earlier that, screens and eye strain from screens has really become a pandemic in today's world. And I completely agree with you. So can you share a little bit more about that, the impact of screen time on our eyes?
Absolutely. So, literally, this impacts everybody because screens are everywhere. And the average American, I read, spends about 7 hours and 4 minutes a day looking out on a screen. That's each day. And that's average, which means there's a lot of people who spend significantly longer than that. And, I think things changed during the pandemic when many of us found ourselves spending more time than ever in front of the digital devices. And now they're literally, screens are everywhere. They've become the new normal. They've taken over work, learning, shopping, dating, buying new clothes, even hanging out or conversing with your next door neighbor. But I think for so many of us, this is creating these symptoms like headaches, eye strain, trouble focusing, dry eyes, light sensitivity, disrupted sleep, even environmentally induced nearsightedness. I mean, the list really goes on and on. And so, if you think about the world that our kids are living in, It's very different, than we were children, Dr. Ronnie. When we were children, we were outside all the time, playing ball with with our neighbors, climbing in the trees, riding our bikes, and it wasn't until it was dark out or it was dinner time where your parents would say, "Come on in. What are you doing?" And now instead of dragging kids inside, we're literally dragging our kids outside, away from screens and technology and social media and all of this, and it's creating some significant challenges now with social development, emotional development, cognitive development, and of course vision development. So I always say, our visual system is intended to guide movement. And evolutionarily, we were scanning the horizon for the
Mhm.
saber-toothed tiger that was coming at us. And now we're scanning, making
Now
those
we're
same
here.
intricate eye movements. Now we're here
Yeah.
on a 2D device with brightness, contrast, where it requires different eye movements than even reading on a page, right? I mean, on a page, they're much more organized and methodical and kind of across midline. And now they're all over the place. They're more erratic. Our blink rate drops significantly when we're on
Mhm.
screens. There's a lot of controversy about blue light, but I think what everybody would agree on is that we shouldn't be having blue light or any light blasted to our eyes and brains all day long for
Mhm.
7 hours and four
Especially
minutes
not at night,
plus.
right?
Right. And even myopia now is increasing at a crazy high rate, and that's the medical term for nearsightedness. If two individuals were to have a child right now and both individuals were nearsighted, their child would have a 1 in 2 chance of being nearsighted. If one parent is, a 1 in 3 chance, and if neither parent is, that child would have a 1 in 4 chance of becoming myopic. And
Mhm.
that's because of not enough time outdoors, too much screen time, and too much near visual concentration tasks in the dark. So, I think this is
Actually
something that,
related to that, sorry to interrupt, but I read that by the year 2050, 50% of our population is expected to be nearsighted, which is it's crazy.
nuts.
It's
And that
crazy.
includes countries that don't have access to technology like we do,
Mhm.
right?
Mhm. Across
That's
the board.
scary.
It's
Yeah.
very scary. So, with screens, you mentioned adults spend of over 7 hours a day. Is there any estimate of how much time children are spending on screens? And also, is there with kids, are there any unique symptoms that they may have, that adults may not experience when they're on screens for such a long period of time?
Yeah. Well, so I actually think that 7 hours and 4 minutes incorporates kids.
Okay,
And that's
average.
all people. So that's average. Somebody who's doing virtual work and they're putting an 8 hour workday, and we're talking at least 8 hours for that person. And
Yeah.
that's a lot of careers and people. I
Yeah.
would
I
say.
I would just add one thing. So, I think the Scientific American published a study, and maybe this is definitely pre-pandemic, maybe 2016 or earlier, and they
Hmm.
estimated that adults spend almost 11 hours a day in front of some kind of screen. So not just visual, but
Oh,
also, listening to music, etc. And children, it was about 6 hours a day. That was back then.
wow.
So who knows
Yeah.
what it is right now?
Yeah. I mean, as we're talking, I want to recheck that stat of the 7 hours and 4 minutes. I bet it's higher now that we know more, right? I mean, that's crazy. I think there we should always everything in moderation, and children, there is a I'm not anti-technology, I'm not anti-screens. I think
Mhm.
there's tremendous value there, but most of us, especially kids, don't have the vision development to thrive in the screen world. And the schools where they're giving a child an iPad and they're basically in the corner at their desk all day long on an iPad. I mean, that's terrible for so many reasons. But to answer your question about symptoms, I think it's a lot easier to see signs of these challenges with our kids when it's harder for them to maybe put to words what they're experiencing.
Mhm.
So a child who is on a screen and they're leaning really close to the screen or pulling the screen really close to them, I always share that that's a pretty clear sign that their focusing system, the inside muscles of the eyes responsible for clarity, we think of it as like an old school camera. It's stuck on manual focus and we need to be on autofocus. And
Mhm.
so that child's adjusting their body to compensate for what their visual system can't do for them. Or the rubbing the eyes, the blinking, the leaning on the desk, or covering an eye when they are reading. And we know about what happens with dopamine and why people want to come back to screens. But I think being able to support the transition away from a screen can help support so many kids in terms of transitions in so many aspects of
Mhm.
life. And I
Yeah.
think, the nearsightedness piece, I mean, every parent listening to this should take their child to get an eye exam, because far away gets blurry very often because of a near problem.
Mhm.
So
Mhm.
you can catch it early enough, you can slow down the progression, in some cases stop it, and in some cases reverse it even.
Yeah. I think, what you mentioned earlier about normally our focus is very dynamic. We look in the distance, we look at intermediate, we look up close. But when we're on screens all the time, that really prolonged focusing is what we believe is contributing to this epidemic of nearsightedness in the world, especially in kids. So, if you do have kids, you're listening, make sure that your kids are taking breaks and not just short breaks, longer breaks. So they're out there, doing other things rather than looking at something at 12 to 14 inches from their face. I've
And
also read
moving their body,
and moving
right?
their
Yeah.
body, absolutely. Because then you can also have, from that posture of looking down, people can develop neck issues and shoulder issues and headaches. We call this all digital eye strain. Now, this leads perfectly actually into something I wanted to have you share with everyone. So, Dr. Appelbaum, you've developed this incredible program for screen time called Screen Fit. So, can you tell us a little bit about that?
Yes. So, can I share a quick story?
Absolutely. Absolutely.
So, when the pandemic hit and we were all thinking the world's going to end, what's going on here? I had an epiphany, and I remember on this Sunday afternoon, looking across the room and seeing uh, my oldest kids, who were 5 at the time, twins, with their heads buried in iPads. And we are not a house that supported iPad use. I don't even know how they got these. They were locked up and in the vault, yet somehow there they were. My 2-year-old at the time was on a play date with her class, her preschool class, and that play date was on a screen. And I remember seeing her literally looking around the screen, thinking, "I see Madeline here. Where is she?" This was literally her first time ever looking at a computer. And my stomach dropped. And, as a functional eye doctor, we were clearly not a house that supported screen use. And yet, here they were engaging with these for playtime, for fun, for just so many aspects of life. And I think that's, to me, when this light bulb went off, thinking, for my kids, but really for the entire world, screens aren't going anywhere, and this is going to become a bigger and bigger problem unless we do something about it to slow down these negative influences that devices are having on our eyes and our brains. And this whole new pandemic was really unfolding then, and that's where we are now. So that's when I created ScreenFit, which is literally like a home workout program instead of going to the gym. So absolutely, you're going to get in better shape if you go to the gym and you work with a trainer and utilize cardio and weights and flexibility and functional work and stretching. But not everybody has access to a gym. And if you're compliant and you do body weight stuff at home, you can get in better shape. Air squats, sit ups, push ups, things like that. So it is always, we want to go see a doctor and work with somebody who's board certified in vision therapy to fix or support these problems that are in place and actually diagnose them. But not everybody has access to that. So this is a kind of revolutionary online vision training program designed to help minimize the damage that screens have on vision. And it's kind of a vision wellness program to reduce symptoms, to promote healthy visual habits during extended screen time, but to really change how somebody's using vision to build that support in place.
Mhm.
And it's got this really cool, unparalleled curriculum that focuses on practical applications of different lessons. There's 2 courses. Each course has 30 lessons. Each lesson is about 10 to 15 minutes to do, and you can literally learn how to relieve the stress that technology places on our visual systems and empower you with the tools to support healthy habits and eye coordination. It is on a screen, so screen fit on a screen does seem a
Mhm.
little counterintuitive for many, but
Mhm.
it's a video of myself talking through what the exercise is or what the lesson is, and then you put the phone or tablet or computer down, and then you do it. And
Mhm.
none of these require equipment, so many of these can be done at a stoplight, in the bathroom, in between patients or clients. I mean, it's meant to have really nice transfer. We've had as young as 5 go through it. successfully and as old as 89, with
Mhm.
100% of people seeing a reduction in symptoms, which every time I say that, I'm kind of like, this is too good to be true. And it's now being offered by Marriott, a bunch of different corporations, and even up for a government contract. So what you brought up initially about the stigma about functional work and vision therapy and even often neuro-optometry, I do think having doctors recommend screen fit is getting us a more stable seat potentially at a medical table for long term, because this is hitting pain points and the proof is in the pudding with it.
I really want to congratulate you, Dr. Appelbaum, for creating ScreenFit because it's something that can help so many people and perhaps people who don't have access to neuro-optometrists like yourself. And it can really break down barriers to getting care and get the people the help that they need. So congratulations on that. And we will have a link to ScreenFit in the show notes if anyone's interested in subscribing, then they can get access. So, Dr.
Yep.
Applebaum, we have been chatting. It's been such a pleasure. I've learned so much from you in this past half hour or so. If there's one last thing you wanted to leave our audience with, what would that be? What would be your message to the world about eye health?
Ooh, I got to pick one. Okay. So I would say if you have a headache, often you go to a neurologist. If you are a child who's have a child who's squirmy in the classroom or desk work, you may go see a psychiatrist or a learning specialist. If you're motion sick, you may see an ENT or an otolaryngologist. But with almost any symptom, I really want people to recognize that vision could be a part of the problem. And that's why I always advocate for everyone putting their vision first. And that goes way beyond just seeing the letters on a letter chart and seeing the doctor about whether you need glasses or not. There's so much more to vision than just 20/20 eyesight.
So true. So true. I couldn't have said it better myself. So, how can people learn more about you? Have they wanted to work with you or find out more about your program? How can they find you?
So our website, myvisionfirst.com, has a lot of really good research on there, a lot of good videos and information about kind of all the stuff that we're doing in our practices in Maryland, right outside Washington, D.C. You go to screenfit.com and any of our social media channels, but I would say the best one would be Instagram, just Dr. Bryce Appelbaum. But remember, we spell Applebaum very strangely. It's E-L, not L-E, because my ancestors wanted to confuse the whole world. But it's all on there, and a lot of really good videos of, oh my gosh, I didn't realize that motion sickness in a car could be related to vision, and here's what can be done to help support that. So
Mhm.
thank you for giving me the opportunity to share those.
Absolutely. And thank you so much for being a guest on the IQ podcast. It's really been an eye-opening discussion. And I hope a lot of people will open their minds and hearts to potential vision therapy. Thank you so much.
Thank you.